Hi everyone. This is Julie.
My name is Chris.
I'm Claudia.
And I'm Kayla.
So we talk about the bond density case research presentation. And the case is about a young man named Darius who broke both of his hips in a minor fall. The doctor was concerned about this because Darius' bone density was abnormally low. Potential issue and major topic: bone density, nutrition, exercise, fracture, hip injuries, and physical rehabilitation. Physiology-related topics or the issues: bone development and remodeling, calcium and phosphorus metabolism, vitamin D metabolism, muscle physiologies, and fracture healing. The important term in phrases: bone density, femoral neck fracture, the lateral orthopedic surgeon, bone density scan, DXA physical rehabilitation, supplemental calcium, vitamin D supplement, and follow-up bone scan. This is a preliminary assessment based on the limit information provided in the case. What I know about the topics: Darius is a young man who broke both of his hips in a minor fall. His bone density is abnormally low. He has been feeling weak for the past month. His diet consists mostly of the junk food, very few fresh food and vegetable, and almost no dairy products. And also his blood calcium level is low. He has surgery to fix his broken hip. He was given supplemental calcium, vitamin D, and multivitamin after surgery. And also his bone density has significant increase 6 months after the surgery. The question I have is, what is the specific cause of Darius' low bone density? Does Darius have any other underlying medical condition that could be contributing to his bone density problems? And how can Darius improve his diet to support the bone health? What type of the exercise is the best for Darius to help improve his bone density and prevent the future fractures? And what is the long-term prognosis for Darius? Will his bone density continue to improve over time? And I also interested in learning more about the following physiology-related topic. How does the bone density affect fracture risk? How does the calcium and vitamin D affect bone health? And how does the exercise affect bone development and remodeling? And lastly is, how does the body heal from the fractures? So now Chris gonna take over the vitamin D, and he will talking about the vitamin D.
Thank you. So vitamin D comes up in this case because of its role in bone health and calcium levels. But what is vitamin D? So vitamin D in the body is activated and turned into a steroid hormone. So steroid hormones are an essential part of the endocrine system as a messenger molecule. And you can see steroid hormones will enter the cell through the plasma membrane and bind with a receptor. And to understand how important vitamin D is you can find receptors throughout most of the cells in the body. So vitamin D does play a role in calcium levels and bone growth, but it also plays a role in other functions, such as the body's immune system. Next slide. So how do we get vitamin D? So some dietary sources of vitamin D are vitamin D fortified dairy, egg yolks, and fatty fish, such as salmon, tuna, and mackerel. Our skin also produces vitamin D when it's exposed to sunlight, but skin color has an effect on how effective we are at making vitamin D. When we get vitamin D through sunlight or through dietary sources, our liver will then convert it into its primary circulating form, and our kidney will convert that into a biologically active form. Our recommended dietary allowance is 600 IU. With Darius, we know his diet consists mostly of junk food and very little dairy, and he also spends a lot of time indoors and gets little sun exposure. So Darius may have low levels of vitamin D. Next slide, please. So how does our body regulate vitamin D, and what are its main effects? So vitamin D is converted into its active form in the kidney, and this is controlled by the parathyroid gland. When calcium levels are low, PTH will be excreted from the parathyroid gland, and this will promote the kidney to convert vitamin D into its active form, calcitriol. So calcitriol has an effect in the small intestines. It promotes calcium ion absorption. We know Darius has low calcium levels, and this may be because of low vitamin D levels. If Darius has low vitamin D levels, it may inhibit his body's ability to absorb calcium. Next slide, please. So how does calcium enter our body? Calcium can enter our body through passive transport and active transport. And this slide shows how proteins are responsible for transporting calcium across a membrane through the cell and out of the cell through an active calcium pump. Next slide, please. Calcitriol plays a role in this, in that it's a hormone that enters these cells and binds to its receptor. And after binding with its receptor, it can promote transcription and production of these calcium binding proteins. Next slide, please. So vitamin D deficiency can cause rickets in children, osteomalacia in adults, and osteoporosis. We know Darius has low bone density, and so we suggest that he monitor his vitamin D levels. A level greater than 20 nanograms per liter is adequate, while less than 12 nanograms per liter shows a vitamin D deficiency. Next slide, please. Claudia will talk about our body's regulation of calcium levels.
Thanks, Chris. So yeah, what happens next? I think we need to know about calcium. Why is it important? Calcium is one of the most important minerals for the human body. 99% of body calcium is in the skeleton. Next slide, please. So yeah, that's really important mineral in this case. What is happening in this slide here is, like, let's look at these pictures. The one on the left shows the parathyroid glands, which are embedded in the thyroid gland. Those are the four little dots shown there. These are important in keeping our calcium level within normal range. When vitamin D level is low, the absorption of calcium in the intestines become less, which then causes the level of calcium in the blood to go down. As a result, the parathyroid glands get stimulated and produce more PTH that causes calcium to come out of the bones, therefore weakening the bones in the case of Darius. And so the picture on the right shows the process a little bit more. The first thing that happens is the body recognizes that there is low calcium in the blood. This acts as a stimulus and activates the receptors in the parathyroid glands with the help of calcitriol, which is released by the liver. These two hormones activate the three boxes displayed on the bottom there of that picture. Osteoclast is a type of bone cell that breaks down bone tissues and release calcium to the blood, which will aid in increasing the blood calcium in the blood. Secondly, the kidney decreases the amount of calcium that will be excreted from the urine, because the PTH and calcitriol hormone signals the kidneys to retain the calcium and recycle it back to the blood. Lastly, these hormones signal the intestines to increase their absorption of calcium into the blood. These three boxes there are their effectors after the body signals the low calcium level to bring back homeostasis. And this is all a negative feedback reaction. And then this slide here shows just an easier visual to understand what the body does when it has low calcium levels, and how it shows the hormone PTH and the corresponding hormones that are affected to regulate the calcium level. Now, after learning all this about how the body reacts when calcium levels are low, it helped us determine what is happening to Darius, and Kayla will now continue with our case study.
Hello, thank you. The two diagnoses that we've come up with for Darius is osteopenia and rickets. Osteopenia is a bone disease that happens when the new bone your body does not make new bone quick enough as it is reabsorbing the old bones. So this causes a decrease in bone mineral density, and overall it will increases the chance of bone fracture. And to be diagnosed with osteopenia, you need a bone density test done. And if it's -1 to 2.5 lower than the normal range of bone density levels, then you're diagnosed with osteopenia. And for Darius' case, they did do a bone scan test on him, and it did come out to be abnormally low. And it does increases the chances of bone fracture, in which Darius had from kind of a really minor incident. That's what caused a concern that's what the doctors were concerned of in the first place. But it didn't show exactly the exact value levels that he had. If you look at this picture here to the right, there's a comparison of normal bone density versus osteopenia and osteoporosis. Osteopenia is kind of right in the middle. It's not too severe, but it's not normal. And so this is a treatable disease, but it's not curable. And I'll touch base with that a little more later. Next is the treatment for osteopenia is increased intake of vitamin D and calcium. And this can be through eating more veggies and fruits and food that contains vitamin D, such as fish, mushrooms, and such. And it also can be the increase of intake can be through just supplements, as vitamin D supplements, multivitamin supplements, and calcium supplements, and then also exercise, as well as exercise does stimulate bone building cells. And we see in Darius' case, he was prescribed multivitamin supplements, vitamin D supplements, and calcium supplements to kind of make up for that bone density level, low bone density level that he had. And he did go through 2 weeks of physical rehab as well. Next is nutritional rickets. There are different types of rickets. Some are more severe than others. I've chosen specifically nutritional rickets because it is a curable disease. This is a bone disease that happens when children lacks vitamin D and calcium in their body. And so it causes the weakening or softening of bones and muscle weakness. In Darius's case, he did have low calcium levels, and he also had muscle fatigue as well. And the treatment for nutritional rickets is increased intake of vitamin D and calcium. Again, just eating more fruits and veggies, and eating food that contains vitamin D, such as salmon, mushrooms, eggs, even dairy as well. And then the other treatment is more sunlight. Being more exposed to sunlight will increase your body to produce more vitamin D in the body. And for Darius's case, he doesn't get much sunlight. We know of this because his mom prefers him not to go outside much, since it's a dangerous neighborhood. And also, since he lives in the inner city, there may not be much sunlight where he lives. So going back to Darius's cases, after 6 months later, after he has done surgery and went through 2 weeks of rehab, and after the doctors prescribed him multivitamins, and the vitamin D supplements. He did a follow-up bone scan, which was done, and it showed an increase of bone density, which led me to kind of sway the diagnosis more towards nutritional rickets, because I've mentioned before that nutritional rickets is in fact curable if the child or the patient is in fact increasing their vitamin D and calcium intake. Whereas with osteopenia, it's treatable, but it's not curable. So yeah. Conclusion, we hope by presenting this, we can gain a better understanding of Darius's case and how to help other people with low bone density and to prevent fractures and improve their overall health. And this is just a references. Thank you guys.